Hi there, I'm Dre, the host and founder of the Dragon Network. On this week's video, I want to talk about another one of the HIMSS maturity models, and that's CCMM. This particular model is 8 stages, 0 through 7, and focuses on the communication and coordination of patient care across a continuum of care sites and providers. Organizations at a CCMM stage 0 will be actively working to improve their MRAM stage scores, but they will have little, if any, communication that is in place electronically. As they work their way up, by the time they reach stage 7, organizations will have a fully integrated care plan that includes multiple protocols and pathways for a patient's condition, and the ability to easily share data elements between the patient, the various protocols, and the relevant providers and care entities, whether they be internal or external. We're going to take a bit closer look at what's involved with each of the stages as they work their way through the 0 to 7. But before we do that, if you haven't had a chance to subscribe to the channel yet, please go ahead and do that now. And as always throughout the video, if you like what you're seeing, don't forget to hit that like button so that I know and can gauge what to put out there in the future. So stage 0, as I mentioned, is where the organization will be working on improving their MRAM score, and they have little, if any, e-communication in place. With stage 1, we start to see some limited sharing of care plans outside of the organization, as well as some externally generated data that can be incorporated into the patient's record. The organization will also start to leverage third-party reference material within their EHR at this stage so that they can leverage the information to support care activities. With stage 1, we also get started with the administrative and governance work required for the CCMM, and the organization will need to have privacy and security policies put in place, as well as policies for disaster recovery and business and care continuity. In order to achieve stage 2 of the CCMM, the organization must make the patient record available to the multidisciplinary care team, which may be both internal and external to the facility. Immunization and disease registries will be maintained for all patients. The organization will also have electronic ID management for patients, providers, and facilities. Another requirement to achieve stage 2 is that some patient-generated data be available to clinicians, and that means that a patient portal will have to be put in place to make it through this stage. To build on the administrative and IT policies that are put in place with stage 1, the organization will need to make sure there's an adequate change control process put in place before they can achieve the next level. Stage 3 of this model requires multi-entity clinical data integrations, along with some coordinated data governance to support those integrations both internally and with external partners. From a patient care perspective, telemedicine, e-consents, and e-referrals need to be put in place. In order to help track patient conditions, medical classification and vocabulary tools will be integrated into the EHR and will be leveraged throughout the general day-to-day work. And finally, to achieve stage 3, the organization's EHR must be connected to a PACS system for medical imaging results, and they must have the ability to integrate their clinical and financial data. With CCMM stage 4, the organization will have shared care plans and will have the ability to generate alerts and reminders for patients and providers with respect to particular patient conditions or care pathways. The organization will also need to have e-prescribe in place to achieve stage 4 and some form of analytic capabilities so they can track things like pandemic response. All the appropriate care team members will have access to the information they need, and policies will be in place to support their collaboration, as well as the interconnectivity, device security, and mobile device use. With stage 5, if it hasn't already been done, all available data from all applicable sources needs to be brought together into a cohesive single patient record. There will be community-wide identity management, and integrated care plans will be based on clinical best practice. Mobile technology will be leveraged to help patients engage in participation through their care journey, which will give them the ability to review personal targets, enter appropriate information to be shared with their care team, and for them to receive reminders and alerts as appropriate. Stage 6 of the CCMM framework is where we see full closed-loop care delivery achieved. And with that, the EHR will track multiple pathways and protocols for each patient, including the relevant patient compliance components. Clinical decision support and population health tracking are available both within the organization and community-wide. And for this stage, the organization will also have policies in place to address any non-compliance issues that may come up. Much like the other HIMSS maturity models, stage 7 is the highest stage that you can achieve with CCMM. And to achieve this, the organization must have fully coordinated care across all settings with some integrated personalized medicine. There will also be comprehensive population health functionalities in place, and communications that are occurring between care team members and between IT systems are going to happen in near real time. Of course, all IT systems and related workflows will also align with national and regional policies. So I mentioned back in stage 0 that with the CCMM, the organizations will be actively working to improve their MRAM scores. As you can see, they'll start out with that in the stage 0 phase, but as they work their way through the other stages in this particular model, you can start to think of where the alignment between the CCMM and the MRAM is actually going to happen. And it's very frequent for organizations to be working on both at the same time, or for them to tackle MRAM all together and get to that stage 6 or stage 7 level before they look to embark upon the CCMM journey. I hope this quick look at the HIMSS CCMM was helpful, and you have a great rest of your day. I will see you again next time.